The pre-procedure evaluation phone program is essential for evaluating patients prior to surgery and invasive procedures for optimal care. The purpose of the PPE call is to identify pre-existing health issues, avoid surgical procedure delays, and contribute to the anesthesia plan of care for optimal patient outcomes. In this video, we will demonstrate best practice for the PPE call. We will use the Quick PPE Call tab on our navigator. Full disclosure, this is not a real patient, and all the health information shown in the video was created for this training demonstration.
Prior to the call, it is helpful to briefly review the patient's medical history, medications, and to check if the patient has specific outside provider, for example, cardiologist. This information is helpful if you need to ask the patient to elaborate on specific issues. If the patient needs a translator, the PPE nurse sets this up prior to calling the patient. In this status board, you will highlight the patient's name, click Anesthesia Evaluation to open their chart. Be sure to be in the Quick PPE call. You can then check the patient in. Click Accept. And then it'll bring you back to the Quick PPE call. Next, you can assign yourself as the nurse here. You just type your name in. If the patient speaks another language, this is where you would document that, and you would document what type of interpreter service you're using. To get the patient's phone number, you click Contacts, Outgoing Call, and the number would appear right here. Once your patient is on the phone, you confirm their name, their date of birth, the surgery they're having, and who is performing that surgery. Then you can go through their allergies, and you would document or add any up here if they had any. Always mark as reviewed when you're done. Then you can go through their vitals, confirm you have their most recent and up-to-date height and weight. You can also document their pain here. Next, you go through each medication they're taking. If they're not taking a medication, you click off Not Taking. If a orange or light brown banner appears that says Medication Review from Outside Source, you would click Go Reconcile. Green font, this is a medication and it does not match a med already in the patient's local Epic chart. Orange font, this is similar to a medication already in the patient's local Epic chart. The purple font, this medication does not map to a med record in our Epic system, but we can look up and add as one in our system if it's found. The black font, this medication is in the local Epic chart and no reconciliation is needed. When you're done with their medication review, you can talk with the patient and tell them which medication they can and cannot take on the day of surgery. If they would like this medication sent to them, we can do this after we hang up the phone call. Next, you open your history. If the patient has any adverse reactions to anesthesia, this is where you would document that, such as post-op nausea, vomiting. Then you would go through each system and document and verify any medical history. After you go through the patient's medical history, you mark as reviewed, and then you can go through the Dassey Questionnaire. This is a questionnaire that helps us gauge their activity level that anesthesia will use for the day of surgery. Next, you'll go through any implants if applicable. This is where you would document if they have a pacemaker or a port. If this patient was a female. After your implants, an OBGYN status tab would appear, and this is where you could document if they've had a hysterectomy or are currently having periods. Next, you go through your Ppe Checklist. You will confirm where you got this information, that you reviewed their history, that they have H&P in their chart. You also want to click off if there is some reason they refuse blood products. This is where you will tell the patient where to arrive on the day of surgery, confirm their NPO status, and confirm if they are going home the same day that they have a ride home, and you can document that information here. Then you can hang up the phone with your patient. You can use your smart phrases to say if they should hold or continue any medications. When you're done with that, if the patient wanted that information sent to them, you would click your communications tab, send it to the patient, and you could send their medication instructions through that way. Lastly, you want to do your PPE note, which automatically populates over here, and it confirms their NPO guidelines. Next, you want to make sure in Procedure Pass that it says Anesthesia Review. If it does not, you can add it here, and you click Anesthesia MD Review. This will allow anesthesia to see the patient's chart. If it does not meet criteria, you click off Not Needed. If the patient has a history of chemo, this would meet criteria, and you would need to note that in your 2.0, which is an anesthesia pre-evaluation. You click anesthesia plan, and they would just write status post chemo. If they're known to have PONV, you can also make note of that here. That way the anesthesiologist will see that on the day of the procedure. Once you're done with your charting, you click Call Complete, and then you check out at the top. This concludes our PPE call video demonstration.